way to Bismarck, North Dakota. We're gonna set up the laser.
Sightpath Medical brings LASIK to the rural setting. They help us with all the tools that these big laser centers in the larger cities have. It all comes out here to help this small town rural community.
When I arrive at the eye clinic, I'll usually park my truck and go in and contact the LASIK coordinator to make sure that the room is ready for us to install. Once that's accomplished, I'll go outside and get my truck, back it up to the door where the equipment will be brought into the building.
My name is Jonathan Hadaway, and I am a senior engineer with Sightpath Medical. Basically, I make sure that everything is in order. I make sure that all the equipment's running perfectly. I make sure all of our engineers are certified and give them any other training that they may need or we think that is necessary.
My name is Bernie Dahl. What I do here at the Eye Clinic in North Dakota is take care of the computers and do all the scheduling. If we have Sightpath come in, what day they're coming in, and so forth. Okay, Craig is a pretty good guy. We enjoy having him come to the office. He brings the laser in, calls a couple of days before to make sure we're ready. He puts down the plywood so he doesn't pop our tile. He comes in, sets up if he needs anything. He lets us know. If we're low in supplies, he tells us. It's something we don't have to come back and check after Sightpath has left. He takes care of anything that's related to the laser for us.
The word RORO is an acronym for roll on, roll off. Basically, it's a piece of equipment that we put all of our lasers on top of. I've seen other companies that do just push the equipment in manually. It usually takes a lot of time to do it manually. So with the help of a RORO, it does cut down the installation time where we can focus on how our equipment is working and also focus on giving the customer their needs instead of back labor the whole install. If you're a patient, you wouldn't want to walk in and see equipment all dented and scratched up, you know, something that looks secondhand. We make sure that all of our equipment looks fresh and new, that when a patient walks in, that there's no evidence that it's not the doctor's equipment.
Once it's in position, we'll apply power, then start a calibration process, which makes sure that the equipment is up to par for the surgery cases the next day.
Hi, my name is Cameron. I'm one of the technicians here that helps the patients. Normally people would have to go 600-700 miles to go and get the laser and everything else, but here, Sightpath Medical brings it all out to us and we can serve our community just like they would in the big cities.
Well, we do care about our patients. The way I look at it is I treat each patient as if it were my son or my mother on that table. I mean, you've got to just deeply care about the outcome. You know, this is people's vision, and that's something that has to be perfect when we're done.
Craig represents Sightpath because he is friendly. He does a lot with our patients. He goes and gets the patients when it is ready for surgery, brings them into the surgery suite. After the surgery is done, Craig himself takes the patient out to the patient education room. To me, he is Sightpath.